Hi, I'm Dr. Jatana. We're going to talk about reasons to consider an operation on your back or your neck. Most patients end up considering surgery when they've had symptoms that have persisted for a certain amount of time. One of the major reasons to consider surgery is that if you've tried everything else and nothing else has worked for about 3 to 6 months, then surgery becomes an option. Typical things that patients try prior to considering surgery include a combination of physical therapy, chiropractic care, physical therapy and its modalities, medications, and or spinal injections. When they have stopped working and symptoms still persist, then surgery becomes a reasonable option. The second reason to consider surgery on your back or your neck is if your symptoms are progressing. And that typically means neurologic progression. What that means is that if you're having progressive weakness or numbness or tingling that is not responding to non-surgical treatment, most patients at that time will consider surgery in that those type of symptoms are starting to compromise their ability to function on a daily basis. So in other words, when a patient comes in and starts to indicate to us that they're having progressive weakness of the use of their arm or their leg, then most surgeons at that point will say it's time to consider an operation. The third reason to consider surgery is reserved for special situations, typically employment that requires a lot of heavy lifting and twisting, or elite athletes. For example, if your job requires that you lift heavy objects repetitively or twist and pull, then you must function at all of your capability to allow you to work consistently. In those particular situations, we would recommend surgery sooner to allow a worker to return to work in a timely fashion so he can perform his occupation. With respect to elite athletes, they require that they function at 100 to 110% of their capability, in a sense that a small amount of compromise prevents them from competing at the elite level. That's why a lot of athletes at the end of the season have surgery as soon as possible to allow them to recover prior to the next season.